Okay, now I'm going to switch over and talk about a couple of our needs. And I put this slide in because this has been a need at the clinic for now more than a couple years. It's just a big empty spot in the clinic because we still don't have family practice doctors. I'm the only physician at the clinic right now, and so that leaves a big hole in the non-surgical care of our patients. We've got a lot of both acute and chronic medical care, non-surgical care, that I don't do a good job of taking care of. And so we really need, for a couple of reasons, family practice. We'd like two. We'd settle for one right now, but we'd like two family practice physicians. And the first reason is obvious for those medical patients who still come to the clinic every day looking for a physician, and we don't have one. And the other thing that we need primary care for is obstetrics. We have a lot of women who want to deliver their babies at the clinic, and they keep asking and asking when we're going to let them do that. And we're not going to be able to do that until we get a couple of family practice doctors. So it's a big void. It's our biggest need right now. So if you're looking for something to pray about regarding the clinic, that would be it. And we really don't, they can be Ecuadorians, they can be missionary doctors, we don't care. And recently we've been able to raise some funds for a physician, which was really exciting, but about the time we got funds to pay a physician, the government has more than doubled the salary that they're paying their primary care physicians at the Social Security hospitals and the other government hospitals. And so, we thought we had this adequate salary to pay a physician, and now we are down in the basement again. And first of all, nobody wants to come to San Lorenzo. There's nothing attractive about it to people who've never been there, and all they hear are horror stories. I mean, the only time we make the news is for something bad that's happened, a submarine of drugs that they found nearby, or a bridge they blew up so they could get drugs out of San Lorenzo. So now not only is it not attractive, our salary is not attractive at all either. So we're going to find somebody. We're going to find a couple people. I'm just not sure when it is. But that's our biggest need right now. And then we talked a little bit about this earlier. And the next thing that we'd like to improve as far as our physical facilities go is better housing for our patients. And we'd like to, we're going to build a wing onto that big yellow building. We're going to build a wing out this way. And we'll not have private rooms, but semi-private rooms. We'll have 4 to 6 rooms where we can put between 2 and 4 patients. We'll have an area that we can use as a delivery room and satisfy some of the Ministry of Health's requirements as well, the nurses station, medicine room, that kind of thing. And we've been working on our architectural plans, and some of you saw this up here at the front. Paul Graber was nice enough to bring us a copy of the architectural plans that we're working on that's up here at the front. So we're doing that. Then we will shortly be working on the structural plans, and once we have that done, we can get a decent budget or estimate of what this is going to cost us. And so, using my little comparison slides, this is what we look like today. And everything takes longer than you'd like it to take, but hopefully in the next year or two, we can have a new picture for this side of the slide. The other thing that we know we can do better is our spiritual care as well. This is Angelita praying with 2 of our eye patients before they went into the operating room for surgery. We don't have a dedicated chaplain at the clinic, and I don't think we really need one because all of our employees, they really care about the patients. They're all Christians. But sometimes, and not always, some days we're not that busy at the clinic, But sometimes we're so busy that everybody's so busy, you don't feel like you have the time you'd like to have to sit down and talk to people. So probably another employee or two would be helpful to free us up a little bit. Maria Luisa has really, in the past couple of years, has really had a burden for evangelism. And so she does a very good job of talking with our patients and sharing with them. But there's always room for improvement.